4 minutes initially.
Good, and in case she's from one more week as ago, then last Cairn thank the last Cairn for allowing me this opportunity to raise this sad and desperate situation. And we'll end Tara Slantown, sir. Chair. No, I refuse to take it because this is a joke. No disrespect to the Minister, but if there's not Minister Daly or someone to take this very serious issue for my county and for the population and the tragic increase in mental health and suicide.
Just one
as a
result. Minister, I take it you're taking Topical to. You've been asked to take Topical to. The deputy is taking it. Minister is taking it.
This just goes to show the kind of interest that your government have, Minister, on mental health. Or the people of Tipperary, it's an outrage. There's 4 junior ministers for health and 1 senior minister, and I couldn't be one of them here to take this topical issue. Topical issue haven't got easy, and thanks to the last Concord, as I said. It's just beggars believe that they send you in here with a script and just fob us off. We're meeting Minister Daly, and for a long time I accept his bona fides, but they're quite useless now. Goodwills and goodwill gestures and telling us he's interested. No guts anymore. He's doing nothing about the situation in Tipperary. We don't have one long stay bed in Tipperary since the so-called Vision for Change, which was ushered in by former Minister Maloney in the Fianna Fáil, then Kathleen Lynch, and now is 3 years out of date, and we still have no places. It's just not funny anymore, Minister. And I had a PQ here recently, and from the head of estates, Mr. Jim Curran, he confirmed to me in a parliamentary reply that while the new design for the proposed upgrade is undergoing a review, the tender process for the project, this is for the crisis house in Clonmel, special Grenville crisis house, to be upgraded. That's not even happening because funding has yet to be confirmed under the HSE capital plan for 2019. Are all the ministers in hiding? We still don't have the 2019 plan, the medical, the HSE capital plan. You're just hiding because you've made such a bags and a unholy mess of the Children's Hospital that every other project is suffering as a result. And I think that this is confirmation of it. We badly need mental health supporters, crisis nurses and other staff to deal with people in Tipperary. Kilkenny is full to the brim. They can't keep us there. Same in North Tipperary, going down to Ennis and Limerick. This is a crisis of high proportions. Reverend Father Michael Toomey has raised it. He came up here and met Jim Daly. We have a committee in South Tipperary, Save Our Hospital, and we're dealing with this as well. Groups like Seesaw and different others, the Suicide Taxi Watch and indeed the River Shore Watch, they're out night and day watching and patrolling. The epidemic of drug dealing in Carrick-on-Shore and Clonmel and many other towns, Tipperary town, you know, every town and village has a crisis now with drugs and nobody to deal with it. And then the whole CAM service for children trying to access those services is in utter dismay. It's completely. Recently I had 2 separate calls from parents whose children are attending child and adolescent mental health services, CAMS, with severe social anxiety and other mental health issues. These children have been referred to the Early Intervention and Disability Services team for an assessment of needs, but they have been told not to expect one for 12 to 18 months. Just imagine that. You should be ashamed, Minister, to be part of a government that deals with vulnerable people like this. These children were due to start secondary school in September and have no services. Even the fact that they have received urgent referrals from CAMS should be sufficient to ensure that these children are seen to. But that's not sufficient. What do we have to do? Mass suicides, we have countless suicides. And an epidemic of mental health, and nothing has happened with this government. You should be ashamed of your life to send back replies like that. And no minister will come in here this evening to deal with it. You can run, but you can't hide, and you can't hide from the people of Tipperary, because this is an epidemic, a crisis epidemic at the moment, and the people are left vulnerable and left mistaken and left sadly short in services for their loved ones.
Minister, you have a reply, please. You have 4 minutes.
Thank you, Cahill. Just at the outset, Minister Daly has asked me to convey his sincere apologies that he could not take this topical issue as he is currently on official government business in Finland. The recent budget provided an additional 55 million to progress new developments in mental health this year, which brings the overall HSE mental health funding to nearly 1 billion in 2019. This in turn will allow for continued improvements to all aspects of mental health care across 9 HSE community healthcare organisations, including CHO 3 and 5, which incorporates County Tipperary. One of the strategic priorities for mental health in the HSE National Service Plan 2019 is to deliver timely, clinical, effective and standardised safe mental health services in adherence to statutory requirements. The provision of acute inpatient care to the adult population of North Tipperary, which is in CHO 3, is provided between the acute unit in University Hospital Limerick, which is 50 beds, and the acute psychiatric unit in Ennis, which is 39 beds. The 44-bed Department of Psychiatry based at St Luke's General Hospital in Kilkenny is designated approved centre for acute services in South Tipperary, which is in CHO 5. This enables all acute inpatient admissions for this CHO area to be managed at a single site. Referrals to St Luke's are through a consultant psychiatrist who makes the clinical decision to admit based on the level of acute presentation or need. In addition to the Department of Psychiatry, there is a dedicated psychiatric liaison team operating from the Emergency Department in St Luke's. All service users presenting to the Emergency Department who require psychiatric assessment will receive that assessment within agreed timeframes, in line with the relevant guidelines. Onward referral pathways are agreed with all service users upon completion of psychiatric assessment in the Emergency Department. Pathways can include admission to an acute unit, referral to a relevant community mental health service team, or referral back to a GP. There is a range of other mental health services for adults in Tipperary. These include psychiatry of old age teams, non-acute beds, day hospitals and day centres. In addition, there are community health teams, mental health teams and high, medium and low support community residences. In relation to those under 18, there are 3 CHAMHS teams operating in Tipperary, 1 in North Tipperary, 2 in South Tipperary. These acute units are at East Lynn in Cork and Merlin Park in Galway. The acute units at East Lynn in Cork and Merlin Park in Galway, which has a total of 42 beds, serve the Tipperary catchment area. The new permanent crisis house to replace Glanville House is included in the HSE's capital programme for 2019 and is currently at tendering phase. The Government is also funding a new jigsaw service for the youth of Tipperary. The plan is now being put in place by Jigsaw with the aim of opening the new service in the early part of 2020. Minister Daly is very aware of the challenges facing mental health services in Tipperary. He has met with Oireachtas members and various local representatives to discuss the current, future provision of mental health services on several occasions, most recently on the 3rd of July 2019.
Well, Margaret, your final 2 supplements.
Have you come in taking a response, Minister? I'll read it out, but to read out untruths, I will not accept. I have a reply here from the head to Parliamentary question from the head of procurement, and he says to me that this Mr. Jim Curran, he confirmed to me in a parliamentary reply that while the new design for proposed upgrade is undergoing a review, the tender process for the project cannot proceed because funding has yet to be confirmed under the HSE capital plan for 2019. Are you telling me now since this morning that the capital plan has been approved? Because it wasn't this morning in leaders' questions. So I will not accept mistruths and baloney from any minister, but especially when you're reading out for somebody else's minister. And what you said there as part of that reply is a sick joke, if it wasn't so serious. One of our strategic priorities for mental health in the HSE National Service Plan 2019 is to deliver, wait for it, timely, clinical, effective and standardised safe mental health services in adherence with statutory requirements. Minister, it's neither delivered timely, not clinically, not effectively, or standardised. We have nothing. Appalling vista. We have nothing in South Tipperary. A skeleton service. You couldn't even give us a room in St Joseph's Hospital, South Tipperary General, that people could go into when they have a psychotic attack when they visit A&E, that they could be separated and be in a quieter place rather than an overcrowded and overburdened A&E. It's a disgrace. And you're telling me now, Minister, I want you to withdraw on your reply because the service plan wasn't agreed this morning and at leaders' questions. So let's just agreed over lunch today or publish. You're telling mistruths, and I will not accept accept that from you or anybody else. I have a reply here to a parliamentary question. You think you can peddle as much untruths as you get away with, but you won't get away with it in Tipperary, and instead you have no place to hide, Minister. It's disgusting. No wonder any of the 5 ministers for health wouldn't come in here. It's a downright disgrace on the second last day before the summer holidays that you get away with this, and you treat the people of Tipperary, especially the people of Tipperary who have mental health issues. It's a total abdication of your responsibility, and you don't deserve to be in government. You deserve to be out milking the cows or someplace else in your farm, but not giving out that kind of diatribe out to me and sick people in Tipperary. And I will not accept it, and I want you to withdraw, Chair, to withdraw that, because the mental health, the health HSE strategy has not been announced, and here's the part of his reply that it is.
Your time is up.
Thank you, I accept that, but I'm so enraged with that diatribe.
No, nothing to say.
Nothing to say, Minister, that's fine.
No, can you not withdraw the fact that you said the Minister, there are 2 minutes left that the HSE National Service Plan, the tenders have gone out. I have a reply from the head of procurement saying the tenders haven't gone out. He's waiting on the service plan to be published.
Your seat.
But this is outrageous.
You got your time.
But what did I get? Mistruths.
Moving on.
And then he raised a white flag and runs away from it.
Thank you.